Hello, my name is Lauren Johnson and welcome to my presentation on the Alice Springs community and Alice. Today I will discuss the town beginnings and history and then continue with an in-depth community analysis. This will include the community structure, population, environment, health resources, and town council and goals. Finally, I will conclude with the 6 main community priorities and the 1 main global community issue affecting Alice Springs. Prior to the arrival of white settlers, the Arrernte Aboriginal tribe inhabited the land the town was founded on and still do to this day. They continued to observe their traditional law while teaching their children the language and culture. In 1862, the explorer John McDouall Stuart led an expedition through the center to the north coast, navigating the country for white settlement. When construction began for the Adelaide to Darwin Line telegraph station in 1871, a watering hole was discovered and named after the wife of the superintendent of telegraph. Alice Springs, named for Alice Todd. Since the station and watering hole were built adjacent to each other, it caused confusion as to the name of the town, and in 1933, the name was officially changed to Alice Springs. Once the railroad from Adelaide to Alice was completed in 1929, the town began to grow due to more reliable transport. When World War II started, the need for roads to connect to the railways was imperative, and Alice Springs played a significant role in the transportation of supplies to the front lines in Darwin. The growth of the town was steady until the mid-1980s, and then it grew drastically due to improvements in vehicle movement. Today, the town is home to 28,000, with frequent visitors from all over the world. Now, where is Alice Springs? Alice Springs is located in the Northern Territory of Australia, in an area that is called the Red Centre. This is primarily due to the red rocks and desert-like landscape. The nearest major city is Adelaide and can be reached via a 2-hour plane ride or 16-hour drive. According to the Australian Bureau of Statistics, the Alice Springs area is a total of 327.51 square miles, with a total population of 28,489 people per the last census. The community structure of Alice Springs is comparable to other small towns, but still offers a lot to its residents and tourists. There are always festivals, events, or the Todd Mall Markets, which are every second Sunday of the month from mid-February until December. Some of these events include sporting events, the Pink Desert Race, Camel Cup, Alice Springs Beanie Festival, and the Henley on the Todd. They occur at various times of the year but draw large numbers of crowds and provide a tremendous source of income for the town and local organizations. The Alice Springs community is home to 19 public and private schools and colleges. 2 of these included are dedicated for the education of Indigenous children, and 7 preschools. While life in Alice has many benefits, it does have some drawbacks or issues that is largely due to the remote location. For instance, the average home cost in 2013 was $440,000, $10,000 higher than the national average. Also, the lack of variety in goods, higher cost of those goods, and the longer wait to have goods delivered when ordered from outside town can be inconvenient. In Australia, the census data is compulsory and collected every 5 years. However, some data is collected more frequently. The 2011 population for Alice Springs was 28,049 people, with a population density of 87 persons per square kilometer. The top 3 most prominent races in the community were Australians at 32.5%, Aboriginal and Torres Strait Islander at 18.6%, and European Americans at 8.8%. While this data is not alarming or unexpected, the family income data for the town and state is not available. Furthermore, the only income data available was for the nation from 2011, and that was the percentage of people receiving public assistance, 30.4%, and those living below the poverty level, which was 11.7%. I was later informed by local accountants that this specific data is not accessible to the public and requires written permission, or if you are in a position that allows you access. The only health concern noted when reviewing the statistics and literature for Alice Springs and the nation were the vast gaps in life expectancy for an Aboriginal compared to non-Aboriginal Australians. The life expectancy of an Aboriginal female is 9.7 years less, and an Aboriginal male is 11.5 years less in comparison to the non-Aboriginal Australian. This is due to chronic diseases and lack of accessibility to health care. Barriers such as acceptability, and affordability are common in remote locations, and that is not any different in Alice Springs. While there are multiple clinics and services for well care visits and basic medical care, extensive services that require specialist consultations are not readily available. The Alice Springs Hospital services the Alice Springs area and surrounding remote communities. The critical cases that require extensive evaluation are often referred to Adelaide. This would include specialist consultations for cardiology, neurology, or specialist surgeons. The specialists do make visits to the area, but it can be 2 to 3 months between visits and can be difficult to obtain an appointment. Affordability is not as much of a burden as it would be in most rural areas of the United States due to the Australian socialized healthcare system known as Medicare, which in most cases does not require any or minimal payment for services rendered. Healthy People 2020. I chose cancer, C-1, reduce the overall cancer death rate, as my number one choice. I chose this objective because as of 2015, 26% of the deaths in Northern Territory were caused by gastric or lung cancer. As my second choice, I chose heart disease and stroke, HDS-4. Increase the proportion of adults who have had their blood pressure measured within the preceding 2 years and can state whether their blood pressure was normal or high. The second leading cause of death in the Northern Territory for 2015, at 23%, was circulatory system diseases, which included ischemic heart and myocardial infarction. Therefore, I chose it as my second objective due to the high prevalence of heart disease in not only the Northern Territory, but also Alice Springs. Sexually transmitted diseases, STD-6, I chose as my third choice, to reduce gonorrhea rates. In regards to Alice Springs and the top 10 communicable diseases, gonococcal infections are ranked second at 25.5% from the 1st of January until the 30th of September in 2016. While the current environmental resources in Alice are adequate, the Alice Springs Town Council has decided to still make it a priority as one of its 6 council initiatives to protect the environmental quality of the town for future generations. They have invested in the Alice Springs Waste Management Facility, and their goal is to maintain an environment advisory committee to provide recommendations to the community's environmental groups and council. They also want to maintain a network that will maintain appropriate drainage systems for the litter and stormwater that will work in conjunction with Northern Territory government. The end goal is for the council is to have both an environment advisory and energy efficient committees to research and promote sustainable and alternative energy efficient opportunities for the town's future. Flooding is the main natural disaster that affects the town of Alice Springs. The 2 pictures at the top of the slide are the Todd River, which as you can see is a dry riverbed and remains so the majority of the time. However, when excessive rain soaked the town, as it did in June of last year, flooding can become a serious problem in a matter of hours. The riverbed will begin to rise and the Todd will begin to flow, which can shut down roads and cause the activations of the standard emergency warning signals. The dark blue area down the center of the map is the Todd River. All the lighter shaded areas surrounding it are the roads and neighborhoods most likely to flood in the event of excessive rains occur. The green numbers are the designated shelters in the event of evacuation. The Alice Springs government leadership is comprised of a large majority of natives of Alice Springs and have a strong, passionate investment in the community and its well-being. The Alice Springs Town Council is led by the Mayor, Fabian Ryan, Deputy Mayor, Jamie DeBreen, Chief Executive Officer is Rex Mooney, and Councilors are Steve Brown, Dave Douglas, Brendan Heenan, Jake Drinko, Eli Melke, and Jacinta Price. Director of Corporate and Community Service is Scott Price, and Director of Finance is Dinesh Pillai. The Council meets on the last Monday of every month, and the official meeting begins at 6 p.m. However, the public is invited to an informal session with elected members at 5:30 prior to the meeting starts. This is highly encouraged to increase involvement from the community and interact with the Council. The current Town Council has outlined 6 goals of the community as areas they would like to improve upon for its citizens. They intend to focus on the economy by supporting the tourism industry, maintaining roads and sidewalks to appropriate standards, and supporting indigenous education and employment. Recreation, culture, and social infrastructure and programs involves improvements to the Alice Springs Library collection and supporting youth and community health programs. The Council hopes to build a stronger environment in Alice by encouraging recycling and waste reduction efforts and improving the regional waste management facility. Through development, the goal is to ensure proper lighting for streets and public places, as well as developing and maintaining all public areas. Public order and safety are extremely important to the Council, and to maintain this, they have sought additional funding for partnerships to provide a safer town, and supporting emergency service organizations in the preparation and delivery of emergency services. Lastly, as an organization, the Council hopes to improve effective media and communication strategies and ensure the greatest return and acceptable risks in managing Council assets. These are brief examples of extensive but promising goals the Council has for the town of Alice Springs. According to the 2016-17, 2019-20 media released by the Mayor in May 2016, the primary focus of the budget is to allocate funds for these projects in order to build a stronger and healthier community. An August article in ABC News brought to light that 44% of the homeless population in the Northern Territory is due to domestic violence. This shocking number means that the Northern Territory also has the highest rate of homelessness per capita in the country. Therefore, I have placed it as #1 priority. Domestic violence is also included as one of the causes of accidental death in the Northern Territory for 2015 at 14%, which makes it third leading cause of death for the territory. Lastly, it is also noted by the Northern Territory Police as one of the most common response calls. Cancer is the #1 leading cause of death in the Northern Territory, with lungs being one of the most common forms at 26%. The respiratory diseases such as chronic obstructive pulmonary disease are also in the top 4 causes of death for the territory at 8.7% for 2015. For both of these reasons, I have made smoking the #3 priority for community problems in Alice Springs. Liver disease, primarily due to alcoholic cirrhosis, is the 6th leading cause of death for the Northern Territory, and alcohol-involved assaults are indicated as another common call for the NT Police. Youth crime has increased in the territory to the point that the past holiday season was named as one of the worst ever after multiple homes and businesses were vandalized. In order to combat this problem, the government has increased numbers to prevent youth crimes before they occur, but are also investing in diversionary programs in early years and alternative rehabilitation schemes. Lastly, but not least by any means for the community, is the ongoing battle for remote healthcare accessibility for those who do not live in town, but in the surrounding communities. How to provide healthcare for those in the furthest and most remote locations is not a new phenomenon or concept for the world or Australia. With that being said, there are some thoughts of how to fix the problem, and more importantly, what we can learn from our peers abroad. The biggest obstacles that the remote healthcare community faces are the attraction to the location and then retention of staff and technology. In the United States, telemedicine has been very successful in bridging the gap between patient and clinician in remote areas. Evidence has shown that clinicians are able to spend more time with patients and handle more complex problems. This was important especially for conditions that required extensive follow-up. Due to the telemedicine environment, providers did have to assume more responsibility, but it enabled a relationship of trust to be established between patient and provider. While globally the focus was on technology, in Australia the focus was put into recruiting and retaining staff to work in these communities. A recent systematic review completed in 2010 noted 3 key strategies to retaining remote healthcare staff. They included bundling retention incentives instead of offering only one form, allowing for flexibility so that the healthcare workers' needs are met, and finally, continuous and accurate monitoring of the workforce retention measures to see what does and does not work. Thank you for viewing my presentation, and I hope you learned something about Alice Springs, Australia.